I think the vast amount of data that AI has access to, and how it processes it, the speed at which it processes it, I think and the way it could affect care, right? So when you're talking about behavioral health or any kind of healthcare, um, if the data is being used to then affect care, right? Even at an augmented level, there's always a concern that this is very private data, um, and you want the AI to use it in a very responsible way, right? So we're looking for, again, how is the data being collected? How is it being used? Is it honoring all our consent mechanisms? And so that's kind of where you want to look for what you want to look for in your technology, but you want to, when you look for, is there lack of transparency? We really want to make sure that we understand how this data is getting used, how is the AI coming up with the results, and we need to understand that because that's what builds trust, right? And one of the things for us is the trust between a clinician and our client is essential. It's critical, right? And we cannot do anything that compromises that trust because it already takes a lot of effort from our very hardworking clinicians to go out there and build that trust with the client. So we don't want to be in a situation where either the misuse of data or breach of data causes mistrust between the clinician and the client, because at the end of the day, the clinician is really the face of what we do. So the client's really not interested that some AI tool did this. It's the clinician's responsible, for the well-being of the client. So I think that part of it, that trust is so critical.